We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Paediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
I can't feel any pulses. We're at St George's Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever. You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm ANAP, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A, give me an E.
love,
Okay, good lad, well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways. Yes. And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
You smell nice. What have you got on today?
Nothing this evening.
Spicy, woody, sort of...
It's woody and oud.
Oh, I see. I've got a good sniffer, haven't I?
There was this man in the airport who walked past me and he just smelled... And I actually stopped him and asked him what he was wearing. I can't believe I said that.
Bear with me a second, I'll have a look for you.
You smell nice.
Thanks, this ghost. Deep night. Oh.
Wow, wow. That's a very good response. That's what we wanted.
Working in Resus today is Registrar Shafi.
Working in A&E is completely about being a team player and a team member. You can't do any magic on your own. She's a bit cold peripherally, and she's tired. In South India, Kerala, from where I am, emergency medicine was kind of developing when I was doing it, and it was in its infancy. Should we start off the first bit here and then see if we can move to Pete's Majors? The ultimate aim was to take this experience back home and then set up better systems in my part of the world.
1, 2, 3.
I walked in one fine day into the UK and I was starting the next day as a registrar in a major trauma center, so it was really, really challenging. He's got a very good pulse.
Very good pulse.
Yeah. It was hard because I've always been a shy person, so I don't talk too much. But it was the colleagues, the consultants, the nurses, the porters, everybody pitched in and made me feel as if I am in one big family. Yeah, I'll speak to you.
Hello, St George's Resus. Oh, sorry. And did you say it's LAS? Male trauma call, ETA 10 minutes.
A 20-year-old motorcyclist is being rushed to St George's after a road traffic collision near Wimbledon.
I'll get a trauma mattress.
When you hear that there has been a motorcyclist who's been involved in a collision, You're thinking about multiple injuries to every system of the body.
The motorcyclist's mother has been informed and is making her way to St George's.
I was at my sister's house in Shepherd's Bush. I didn't answer the phone straight away, I have to admit. I saw Antonio ring and I thought, oh, he must be wanting some money. So I thought, oh, I'll call him back in a minute. But then he rang again and I thought this might be a bit urgent, so obviously I answered the phone. And he told me, Mum, I've had an accident. I was literally just like running around, panicking, didn't know what to do. I was in tears, really. And all I wanted to do was be there and make sure that he's okay.
So Antonio, he is 20. He was riding his motorbike. So he's impacted the front right side of the car. He says that his head hit the bonnet of the car.
Okay. Can we have a primary survey, please? Can you wiggle your toes for me? Because there is very loss of consciousness. Based on the mechanism and the fact that he's got some distracting injury, we'll go for a head-to-pelvis CT. A distracting injury is an injury which is very obvious initially to the clinician. There may be more subtle injuries, which, if not taken care of, can quickly kill the patient. We're doing a CT, we'll go for a head-to-pelvis.
Stay still.
Antonio will be sent for an emergency CT scan to assess the damage to his right leg and check if he has any underlying internal injuries.
I was very worried. Any parent would be. I was just worried about him being permanently affected.
Year-old motorcyclist Antonio has been rushed to A&E after a road traffic collision with a car. Doctors have sent him for an urgent CT scan. They are concerned about a potential arterial bleed, damage to the nerve or ligaments of his right leg, and any hidden internal injuries.
1, 2, 3. Yeah.
Single mum Dawn has travelled to St George's from her home in Putney.
I wanted to be a mum quite young. I thought if I had my children quite young, I'd sort of grow up with them and do things together.
Breathe in and hold your breath.
In that sense, it's probably made us a bit closer. I was nearly 19 with my first. I just felt I was ready to be a mum. But when you're younger, you don't realise that you're not quite grown up. You think you're very mature. I was still in my 20s when I got pregnant with Antonio. Antonio was a funny little baby. He was hard work, always on the go, very hyperactive. He's growing up quite well. Still sort of hard work and exhausting because he's so hyper. But he's an adult and he needs some sort of passion. He was quite excited about having a bike. It's the freedom. The bike has given him that independence.
Breathe normally.
His friends have all got bikes and he goes out with them. I think he'd be absolutely devastated if he couldn't ride again.
Finished. Are you all right? Ready, brace, slide.
No, that's not.
A&E, can I help?
Why don't we have a bet on which bit you broke? I think you broke this bit.
Well, that bit's a funny colour as well.
Correct. I think you broke the swollen and funny coloured bit, whereas you think you broke the bit that looks entirely normal.
That's bent. It's bent inwards.
This bit's bent because this bit's in the wrong orientation.
Do I have to go to school tomorrow?
Yes. Do I have to go to work? Yes.
OK, hold the line, I'll put you through, OK? I don't understand people. I get, like, you might not know their full date of birth.
Oh, it's my mum. What's the date of birth? Don't know. What month was it? Don't know. What's the year? I don't know. How can you not know when your mum was born?
Look, there's my goosebumps again. You're cold. Do you want your jacket? It's there.
Newlywed 29-year-old Hayley has come to A&E with an infection and other symptoms that might be due to a weakened immune system. Her wife Emma is with her.
At least we've got a window. I love that they've got that blind down on the door and a massive window. That's hilarious. I met Emma because I almost tripped her up in a line whilst we were waiting for theatre tickets for Legally Blonde. We did the normal kind of apology, sorry, didn't mean to trip you up kind of thing. And I said, oh, I'm a nanny, and she said, oh, me too. So we've swapped numbers. Because you don't get a call button in here, do you? Oh, yeah, there's one there. That's a call button. A cup of tea would be lovely.
I was almost 30, and I'd never really even thought about being with a woman. So it was absolutely like a shocker for me. I think it just developed over time, and it took us both a while to realise it. And then when we did realise, that was it. It was a hard first few months, and everybody's like, oh, I don't give you a year, and here we are, 5 years later.
Hi, Hayley.
Hello.
Hi, my name is Anna. I'm one of the nurses.
Yeah.
How are you feeling?
All right, not too bad.
All right. Are you allergic to anything that you know of? No.
5 years later, I told Emma about my plans to kind of marry her in New York at Christmas.
It's not painful?
No. It was originally a surprise. You then realise that if it's another girl you're marrying, you can't make it a surprise because they're far too precious over like what they're going to wear and how the day is going to go. So we were all over in New York, myself, Emma, her sister and their mum. Getting married there is incredibly easy. We've always described it to other people as being a little bit like Argos. You go in, you pay, you get your little ticket, and you wait in line for your ceremony.
And you've had some blood tests, yeah?
Yeah, I've had blood tests, yeah.
We almost fell out putting the dresses on before we even got married.
I had a simple zip-up back to my dress, so it took about 3 seconds. Emma decided to go for a corset back, which took about 30 minutes to lace up nicely.
It was a weird way to get married, but also it was really nice because we actually did it for us as opposed to a load of other people.
You've got married, you've got a wife, you've always got somebody who's there for you. It's lovely.
You have pain in your leg?
Yeah, I have like my left ankle is like swelled up, and I've got like pain in my leg.
You want some painkillers for the leg, or are you okay?
It's okay if I'm not kind of using it.
All right, see you in a bit.
See you in a bit.
Once we got married, that was it. We were then going to just go off and worry about us for a little while. And we had some lovely plans, which hopefully we can pick back up once all this is over. But we'll see. We'll see what happens.
I need to go for a wee, but I'm worried if I go that someone's going to come and they're going to whisk you off somewhere.
A&E. Fallen off a horse, yeah?
Oh, wow.
Like. Adult female trauma call, ETA, 15 minutes.
40-year-old Karen has been transferred to St George's Major Trauma Centre after being thrown from her horse. Consultant Rathan is in charge of resus today.
When someone falls off a horse, you have to expect the worst case scenario, especially if the patient is a transfer patient from another hospital. Usually the horse has been startled, so the horse is rearing up, so they've fallen quite a fair distance and landed quite heavily. In spite of wearing a helmet, they could still have broken the skull. They could still have a bleed inside the brain. And if they fell heavily onto the chest, they could have broken ribs, collapsed lungs, and bleeding into the chest cavity.
The woman was found at the scene by a friend who called for an ambulance. Her family are 500 miles away in Scotland and have been notified.
I know Karen because I have a private yard and she needed somewhere to put her horse. So I said that I'd be more than happy to have her up at mine. That day, I just dropped my children off at school. After that, I had a few minutes spare before I had to go to work. So I just thought, right, I'll go and do a few odd jobs up at the yard. As I was going up the driveway, I saw something lying in the middle of the yard and got closer and realised that it was Karen. I was worried that she had seriously hurt her spine because she was curled up and she just couldn't move.
All right, on your count. All right, everyone listening up.
She came off a horse, head over, onto her head and her right hand, shoulder and side.
Earlier CT scans reveal some potential damage to her lungs.
So from what I understand is she's got 1 to 9 rib fractures on the right. She's got a right clavicular fracture. She's got a right scapular fracture. She's got pulmonary contusions. Thank you very much.
No problem.
A pulmonary contusion is a bruise to the lungs.
Karen, my name is Nigel. What we're going to do now is just do a whole series of quick tests.
When you break your ribs, they can puncture your lungs, causing your lungs to collapse.
Take a deep breath in for me, and again.
Besides just collapsing your lung, it can cut blood vessels, it can damage blood vessels, and you can bleed heavily into your chest cavity. And that can suffocate you by preventing you breathing.
Doctors will carry out further tests and x-rays to Karen's ribs, shoulders and chest to assess whether she'll need emergency surgery to her lungs. "20-year-old motorcyclist Antonio is in A&E after a road traffic collision with a car near his home in Wimbledon. His mum, Dawn, has now arrived at St George's.
Hello.
Hello.
You all right, darling?
I guess, yeah.
Oh, God. I've worried the living daylights out of me you have today.
Mom.
Yes.
My name is Elena. I'm one of the nurses looking after him. He has been for an X-ray and a CT scan.
Okay. I'll come round.
I'm claustrophobic as well. I like to be able to move.
Try your best to keep still for a bit.
School was not easy for Antonio, to say the least. He really struggled. He couldn't sit still. He went to 3 primary schools and 2 secondary schools.
I'm not staying a night.
Do as your mother tells you.
No, I'm not staying overnight.
Don't argue with me.
I'd literally walk him to school and then I'd get home and I'd get a phone call, can you come and pick him up? And they just couldn't cope with his behaviour.
I'm not staying a night here.
Listen, you do as you're told.
But I kept on supporting him the best I could. I know Antonio very well and I know what he's good at, and I've always encouraged the things that he's good at rather than worrying about the things that he's not good at.
I hit a Prius. It was a Prius. Oh, I'm ashamed to hit the front of one of those.
I'm just happy you're alive.
And it's ugly as well. Prius is ugly.
He's definitely into motorbikes, big time.
I bet you can't wait till I get my 1000cc bike, innit?
No.
He does the motorcycle maintenance at college. He's always showing me different bikes and saying, oh, Mum, look at this one, look at that one.
I've got to go into college on the 20th.
I know.
He's really, really enjoyed being there. And they're a really good college, very supportive.
If we manage to get a new bike, I'm riding.
You won't be able to be riding anything with a big plaster cast on your leg. No, you won't be.
Seeing him finding a college that worked well for him makes me very happy. I'm sure he will fly through it and do really well.
Doctors now have the initial results of Antonio's CT scans of his right leg.
So the top of the tibia is split into these ridges and the plateau.
So is it smashed up into it then?
In this case, it's probably a side impact. Yeah. There's been a lateral flexion, and it's just crumbled. The femoral condyles have impacted on it and ground a bit off.
Oh, my God.
Oh, shit.
That's pretty bad.
That's deep.
Becoming a bit swollen.
Yeah, it's very swollen.
It's very swollen.
It's really bloomed up.
You do expect swelling with any significant trauma. But if there is an acute new swelling, then that is a pretty dangerous sign. Is this patient actually starting to bleed again? Was there a contained blood clot that is now dislodged, causing more bleeding? Does that patient need to go to theatre to have that pressure released?
No way.
All right.
It wasn't as swollen before.
Doctors must now carry out further tests to see if Antonio will need emergency surgery to save his leg.
All right, lie down.
Ah.
Close your eyes and scrunch them up. Don't let me open them. Good, okay, and relax. Puff your cheeks out, don't let me puff them in. That's good, good Togo, okay, relax. Just open your mouth as wide as you can. And just say, ah. Good, lovely, that's fine. And just look up with your eyes, look down, look to your husband. Growl.
40-year-old Karen has been transferred to St George's Trauma Unit after being thrown from her horse. Initial scans have revealed multiple shattered ribs, a broken collarbone, broken shoulder blade, and potential damage to her lungs that could need surgery. Specialist doctors are examining her scans and carrying out further tests.
Hello, is it Karen? Just want to do an X-ray of your chest.
I grew up in a small town in the northeast of Scotland called Fraserburgh. It's a fishing town, very cold and windy, even in summertime. You get like 5 days of summer. Always been mad crazy about horses. The first time I went riding was when I was really small. My great-grandfather had Shetland ponies on his farm, and we used to get plunked up on them. Every Christmas, dear Santa, can I get a pony? And it was always like, you want a pony, you got to save up and buy it yourself. So that's what I had to do in the end. My parents didn't have money to pay for lessons, so I'd work and get free riding. So I learned the hard way.
Right, Karen, just take a breath in for me.
My granny, she understood me.
Hold your breath.
She taught me always to just keep doing what you want to do and do what you love. She knew that I was really passionate about horses, and when I got a pony on loan when I was 16, she helped me pay for the insurance and everything else because she knew I didn't have much money at the time. She's like a second mum to me, and I think that's why we had a good bond together. It's been different since she died.
done. That'll go for the doctors to have a look at, okay?
Anyway, how did it go yesterday?
Well, it was a very quick funeral. It's about 20 minutes.
No, quick in it.
The funerals took place. They were outside, we're looking at the flowers. Vicky's son was looking at Lisa. They said, "You fancy going out for dinner Friday night?"
What did she say to that?
You all right?
She didn't, did she?
It was hysterical.
Oh, dear.
You never know where you'll find love. At a funeral, of all places.
Oh my God. Do you know what? Good for her.
Yeah.
And I'd love to think if someone came to my funeral, if they found love at my funeral, I'd be thrilled.
I'll give up. My blood pressure go up.
You never wear the outfit I pick you out. You always change it in the morning.
It's quite hot for being in here because it's absolutely boiling.
Well, you need a swimsuit for being in here.
To be honest, I didn't have the energy to change it this morning.
It's 30 minutes since newlyweds Emma and Hayley arrived in A&E. Hayley is undergoing tests for an infection and other symptoms that could be caused by a weakened immune system.
My name's Amelia, and you're Hayley, is that right? All right. I've had a little read of your notes, so I know roughly what's going on, but I want to hear it from you.
My left ankle's gone really swollen.
Okay.
When I walk and lift up my leg, it hurts.
And what kind of type of pain is it?
It's like growing pains. It feels like growing pains. It's
Okay.
like,
Have you had anything else with the pain?
just like goosebumps.
Goosebumps.
Yeah.
All right.
I don't know if that's just chemo.
Yeah, you're quite new to this still, aren't you?
I'm on phase 2 of my treatment now.
Okay.
Second day of phase 2.
Second day of phase 2.
Yeah.
All right. Can I have a look?
Yeah.
Is that all right? I'm just going to roll these up a bit so I can have a look.
I was feeling unwell. It was almost exactly 4 months since our wedding. I had a swelling on my collarbone. So I went to the doctor. 2 weeks later, I still had this lump. And then I got this awful headache at the top of my head.
And your foot is relatively swelling free, actually.
So I went back to the GP, and this was on the Tuesday.
It's mainly around the ankle.
St. George's called me at 8 a.m. on the Wednesday and told me to report to A&E. I was admitted straight away and put into isolation because I was too susceptible to infection. And on the Friday, I found out that I had acute lymphoblastic leukemia. My world absolutely turned upside down. After my diagnosis, they started me straight away on a chemotherapy regime, and that lasted for 5.5 weeks. When you hear the word chemotherapy, you automatically assume hair loss. So the first thing I did was I cut my hair and I donated it to the Princess Trust, which makes wigs for children. When we go out together, I like to wear my wig because people are then not looking at you.
And when I'm pressing here, can you feel the pain?
Yeah. I wasn't wearing my wig the other day because I'd washed it, and I got on the bus and somebody called me sir.
Any other regular meds you take?
No.
So it's just the sort of the chemo that you're getting.
Oh, she's got tons of tablets.
You've got tons of tablets.
Yeah, I'm on like antiviral, anti-sickness, anti-fungal, whatever else.
Anti-everything.
Yeah.
Yeah.
As a couple, we are much, much closer now because of this diagnosis. But there's a slight restriction on our being able to live life to the full. It's kind of on hold at the moment.
I'm going to go check the rest of your blood test and I'll have a little chat with our consultant and see what the plan's going to be, okay? And I'll come back and let you know.
All right, thank you very much.
Yeah.
Brilliant, thank
All right.
you.
See you in a bit.
Doctors are concerned about motorcyclist Antonio's swelling in his right leg and whether there's any internal bleeding and potential damage to his ligaments and nerves.
So we're just still waiting for the results. His leg is just ballooned up. All right, I'll keep you informed anyway. We just message Auntie Claire. We should be worried about you.
Tell her I'm a liar. Still partially kicking.
I grew up in West London, near Ealing.
I'm going to give you a big amount altogether now, because I know you're in a bit of pain.
Yeah.
I went to live with my adopted parents when I was about 9.
Why this Italian name, by the way?
Italian relatives.
Because I'm Italian.
My adopted father was from Italy, which is why Antonio is named Antonio. He was named after my grandfather, my nonno.
Well, my full name's Antonio Enrico Michael.
I always got on very well with him. I used to go to Italy a lot when I was younger, to my nonna and nonno's house, and that was our summer holidays every year.
Going on my story, my Snapchat story.
If you're adopted, that's a normal reaction, isn't it, that you would feel that you're not wanted. It's always like part of you's out there, missing in some sense. You do search for that, I think, in your own life to feel wanted. But my children are the ones that give me joy.
Yo.
How are you feeling? Any damage done to yourself?
Oh, yeah, I think I got a fractured leg.
Sorry. Right, bye, I'm sorry.
Bye, it's all right, bye.
I talked about finding my birth family a lot over the years. My daughter said, oh, there's this website for people who are adopted. I was really shocked when I got this message back from this lady. She said, I think I'm your auntie.
Claire said, big kisses, hope he's okay.
So that's a thank you.
She gave me my dad's telephone number. I was able to ring him, and then he arranged to come and visit me. It was nice to sort of find out that I have loads of brothers and sisters. It's closure.
Don't worry, man, I'm fine.
I know. Mum always worries. That's mother's jobs.
Dr. Shafi has called an orthopaedic specialist to assess Antonio's leg.
Hi, I'm Andrew. I'm one of the orthopaedic registrars. What we've seen from the CT scan is you've got a bit of a fracture of the lower leg bone at the joint on the inside and the outside of the leg. You can probably feel that.
I can feel it, yeah.
When you see such a bad injury, you know that this person is going to have complex surgery on his knee. He's not going to be able to get back to his baseline and get back on a motorbike. It completely takes away your independence if you've got a major knee injury. And for somebody who's in his 20s, that can be life-changing.
Just keep your head still for now.
I was thinking we were finally making some sort of progress with his education, because school's always been difficult, and that he could do something that he really enjoys and loves, and he could do well with that.
To the left, and to the right.
The accident is going to set him back mentally as well as physically.
I think there's probably a lot of ligament injuries there. I think the best thing to do is we'll get an MRI scan tomorrow to see what exactly has been done, okay?
Yeah.
Antonio will now be taken to a ward for further scans and emergency surgery to his leg, so that doctors can give him the best chance of walking normally again.
That can't stay in there forever. You should keep that.
I'll tell you what, I want it back. It costs 10 quid.
Really? You're not going to use that again, are you?
Hey, it's still sharp.
I noticed.
I noticed.
Earlier, Karen suffered multiple injuries to her shoulder, ribs and lungs after being thrown from her horse.
Good?
Yeah.
Bit more?
Doctors now have the results from her x-rays.
She's already dropping her sats a little bit, so they think it's going to get worse before it gets better. Any injury to the shoulder blade will restrict the movement of that arm. And when you limit the movement of a limb, obviously it's going to impact on your life and your lifestyle. It will take a long time to go back to horse riding.
Hello, we've got the images now from the other hospital, and we've had a look at them. You've got some multiple rib fractures, okay, and some blunt injury to the lung as well. So we'll keep you on a trauma ward where our team will be looking after you collectively, okay?
My granny was called Ethel. She played a special part in my life when I was growing up. Especially when I was a teenager. My mum was in and out of hospital and she lived a few doors up the street, so we would always go up there if we needed her, and she was always around. She's with a great granny and she kind of kept everybody together, and if there was any fighting between brothers, sisters, cousins, she would always try and sort it all out and keep everybody straight. You know, she was good that way. It's like a pain.
Yeah, we'll try to organize some better painkillers for you. Maybe some, what we call block.
Yeah, we do them with the horses.
Okay, you do them with the horses, okay.
When my granny was in her early 70s, we found out she had cancer. It was very hard to know that there was nothing that could be done for her. I asked her, is there anything specifically she wanted to do, any country she wanted to go and visit, or anything she wanted to do? And her answer was she wanted to just be at home and watch kids grow up. And she lived for another couple of years beyond then. So it was good. She managed to see some of the kids growing up a little bit more. That was nice for her.
Now we're going to move now, okay?
About a year after my granny died, I decided to get a tattoo on my foot. And I've got her initials in a vine on my foot, so she's always there with me.
Karen will now be taken to a high dependency unit, where specialist doctors will continue to assess the damage to her lungs and prepare her for emergency surgery to fix her broken shoulder.
Hayley, have you been drinking enough water?
Yes, why?
Just wondered.
Why did you ask that?
Well, because we're worried that's a blood clot.
Newlywed Hayley was recently diagnosed with leukemia. She's been undergoing chemotherapy and has come to A&E with an infection and other symptoms.
Because if there was something, you want to catch it earlier rather than later.
Exactly, you've got you. Like, whereas for you, it'd be like, leave it a couple of days.
And see if my immune system fights it off.
Yeah.
We're learning all this as we go along.
Hiya. Hello. Just a couple more questions, all right? Have you had any fevers at all?
I don't really get fevers.
Okay.
The next part of the treatment is a stem cell transplant, which will hopefully enable me to have a whole new working immune system.
Yesterday I had lumbar puncture, I had IT.
Can I have a look?
Yeah,
Is that all right?
Emma's been fantastic. Just being my wife and, you know, trying to keep things as normal as possible. Feel free to rip off anything you want.
I will, I'm afraid. So
yeah.
Brace for it.
No, you're fine.
Sorry.
It does change a relationship to a degree, but it also makes you stronger as well. There are times when I've thought I could just walk away. She's even gone, why don't you just leave me? But then, why would you do that? And I wouldn't do that.
It's nice to have somebody who you can tell how you're feeling. It's also nice to have somebody that you can get really cross with, who kind of gets why you're getting really cross. Because I was very cross in the beginning, that this had just like ruined my life.
Is it a little bit tender around here?
Yeah.
For Hayley, I'd imagine it's a struggle every day. You're literally faced with your own mortality. But also, I was faced with her mortality as well, and, you know, being left on your own. But this is one of those situations where you do need to remain positive and know that she is going to be coming home at the end of the day, so, yeah.
Okay, so I had a chat with our consultant. There's nothing concerning on your blood. Just would advise you just to mention this to your doctors that you see tomorrow, the oncology guys, before you get your next dose. Okay, we'll let you go home tonight.
Fine.
I'll see you soon.
Thank you. Apparently you age about 30 years if you have chemo. So I'm gonna
You're beautiful. Don't.
Shut up.
Don't.
What? Have you actually looked at my face?
Yes.
I think the odds are 70-30.
You were reassured and discharged.
So we'll hope for the 70. Should we go? Which way we go? That way.
I see love every day in the hospital, every day, in and out of every shift. Knowing that you have an illness and knowing that there are people to support you is essentially 50% of the treatment. The medicines can work, but they only work once the person has support from his near and dear ones. And I think it is as important as medicine.
Our mind's at rest now.
When I come home, there were some days you couldn't even wash your hair, you couldn't lift a cup of tea, and you would get so frustrated. It was 12 weeks, the surgeon said, so I had the 7th of September in my diary, and that was my goal. Somebody turned up the yard and they said, I'm getting on. They said, you're crazy. You're not ready yet. I said, I'm fine. I'll be getting on. And I got on and went for a little walk. There's a lot of people, you know, who can be reluctant to do something, but you've just got to get back on there and do it. You've got to get back on the horse and ride.
I just thought he had a broken leg, but the damage that he actually did have, multiple fractures in the knee and torn ligaments, is a lot worse, and it takes a lot longer to recover. I think he always will be permanently affected. I don't think his leg will ever really be the same. Yeah, it's worrying.
The most frustrating thing was just walking. You don't realise how hard it is until something happens to your leg. I kept on having panic attacks, and there was kind of a lot to handle, and I was just walking around on crutches. I felt everyone just looking at me, and I was like, oh, I can't deal with this, you know what I mean? I just asked if I could come back next year, and they was like, yeah, sure. They'd done quite a lot to help us. Shout out to South Thames.
Maybe one day he might even own his own garage. You know, I could see him doing that, fixing bikes and cars and things. Yeah, I think he'd be really good at it.
Emma and I would love to have children.
Hayley had her eggs taken out and frozen because the effects of the high-dose chemo and the radiotherapy will render her infertile.
If it happens, great. If it doesn't happen, you know, that's life, isn't it?
At the end of the day, we've always said we'd rather have no children and be with each other than have children and not be with each other. We've had a lot of things trying to tear us apart and it's never worked before, so the leukemia can do one as well, because it's not going to work.
Yeah, it's a kite.
Hello, St George's ED. Adult male trauma call, 10 minutes.
If they fallen off the ramps on the back of lorries, gone to hard tarmac, we expect the worst.
Okay, so this is Neil. Neil is 52 years old.
It made me realise that you do take your parents for granted, because they're just there all the time, but then you don't think about losing them, do you?
On the scan of your head, we found something that we weren't expecting.